Let's get started, everyone. Good morning and welcome to the San Mateo County Dental Society's meeting. My name is Jim Icardi. I'm the Operations Specialist of SMCDS. Before we get started, I want to review how we'll be running this meeting. All participants will be placed on mute to begin. Our presenter will provide a presentation on what you don't know about long-term care planning. Questions will be answered after the presentation. You may unmute yourself or enter them in the chat box. Today's presenter is Michael Wong with California Life and Disability and Long-Term Care Resource. Mike is a San Francisco native who graduated from UOP Dental in 1994 and a former Air Force Reserve officer. Car accident and back injury derailed his dental career, but he has managed to reinvent himself into an insurance professional and specializing in long-term care planning. Having worked at Invisalign, Mike still has a passion for dentistry, technology, and innovation. He has been an SMCDS business member since 2019, and he remained a valuable resource to our members. So without any further delay, here's Michael Wong.
Morning, everyone. Welcome. I really appreciate everyone coming in this Saturday morning. So what I hope today we can do is help you learn more about long-term care planning. And in case you didn't know, November is Long-Term Care Awareness Month. So let's get started. So I'm wondering how many of you have ever assisted a family member or relative with long-term care? In the chat, could you put a 1 for yes and a 2 for no? You can do that now.
Recording in progress.
Okay, great. It looks like we have a couple of people that have actually assisted some people have not. So what I hope to do is educate you about how it is to assist someone, what it means to your family and how it impacts your family. And 2 is how to mitigate any financial risk to yourself and to your family. So I specialize in life insurance for the living and long-term care planning. And my background is I'm with California Life and Disability and Long-Term Care Resources. I have a certification in long-term care planning, and I went to UOP for dental school. So a little bit about myself. So I took care of both my parents in regards to long-term care for 13 years. And so if you look at this picture, this is my wedding picture, and our 20-year anniversary is actually next week. So my mom here, 2 months after this picture was taken, was diagnosed with stage 3 lung cancer. So my wife and I took care of her for about a year, and then it just got to be too much, where she needed 24-hour care help. And so one thing that affected us was that we wish we got help earlier. When people need long-term care, a lot of families wait too long, and so they get burnt out. And I would say we were thoroughly burnt out by that time. But having someone else do the care instead of us doing it gave us more time to, to be with her and to be more as a family instead of having to do the work. So with my dad was actually a social worker in Alameda County. He actually took care of people on welfare, and he dealt with a lot of people with long-term care, but he was always in denial that it would ever happen to me. And this quote here is, don't put me in nursing home. I heard this from when I was a kid. He would always say that to me. But one thing he didn't do was he didn't plan for it. But after my mom passed away, my wife and I took it upon ourselves to make sure we didn't have to go through this with him. And it was really valuable that we did some planning for him, because he suffered from dementia and Parkinson's disease. And so his care started low, about $4,500 a month. When he passed away, it was about 11,500. But he was in really nice facilities. He had great care. It allowed my wife and I to raise our two small kids. And people always, at that time, they would say, well, how many kids do you have? I would say, I have a 2-year-old, I have a 4-year-old, and I have an 83-year-old. So that's kind of how it was back then. So let's get into what long-term care is. So long-term care is custodial care. It's not medical care. So when you think of things you do in the morning, getting out of bed, taking a shower, using the restroom, eating, dressing, those are things we generally don't think about. But long-term care is when you don't have the ability to do it on your own. You need help. So the true definition of long-term care is you're unable to do 2 of the 6 activities of daily living on your own. So it doesn't matter how you became that way. It's just that you need the help. So it can be from a physical disability, such as old age, you've had an accident, paralysis, Parkinson's disease, or it could be from a cognitive impairment. So it's an or. Doesn't matter how you got there, it's just that you need help. So there are 3 levels of long-term care. So one is home health care. The second level, a little bit higher level of care, is a residential assisted living facilities and memory care. And then there's the skilled nursing facility. So we typically hear the nursing home. So that is what the skilled nursing facility is. So basically, most of the people in the US, about 75%, get care here at home. About 15% in the assisted living, and about 10% in the nursing home. So that's kind of how it works out in the United States. So I have a quick question. So how much do you think it costs for 8 hours a day, 20 days a month for a home health aide to come into your house? So we have a 4,800, 5,600, 6,400, or 7,200. So in the chat, would you mind putting what you think, A, B, C, or D? So I got, okay, so 5,600, 6,400. So what this equates to about, so this is $30 an hour. This is 35. This is $40 an hour. This is 45. So right now, the average is about $40 an hour. So the pandemic has really increased the salaries for the workers. The workers typically live in the East Bay, and COVID has made them want to only see 1 or 2 families a week. So the prices have really gone up dramatically this past year and a half. So let's talk about home health care. So in home health care, a home health aide comes to your home. They'll assist you with activities of daily living, but they also might help with housekeeping, laundry, cooking. And the thing about when someone's sick or has like a chronic issue, they have a multitude of doctor's appointments. So that person can take yourself or your loved one to the doctor's appointment, so the family doesn't have to take time off of work to escort them to the appointments. So right now, the cost for 8 hours a day, 5 days a week is about $6,400. If you need 24-hour a day care, 7 days a week, which is what my mom had, so right now you're looking about $700 a day, so about $21,000 a month for today's prices. So let's look at assisted living and memory care. So my dad was at Atria in Foster City. So that's they have assisted living and memory care. So the aides are there 24 hours a day. So there's always someone around to help you. It's inclusive of accommodation and meals. So one price covers everything there. They have really robust social and exercise programs for the residents, and they'll escort the residents to their medical appointments. So they'll take them there. They will get a report from the doctor and report back to the family, what transpired, change in medication, change in, upcoming tests. So they'll help you there. So right now we're about $6,400 a month. So with the assisted living facilities, they actually have a wing called memory care, so which my dad was in. So those are for the dementia and Alzheimer's residents. And so, you have pretty much the same benefits as the general population, but the ratio is a little smaller. There's less residents, more care, and there is more security. So basically those residents are locked in that area, so they're not able to wander off. So the care there right now averages about $9,000. So, about a little less than 50% more than just a regular assisted living. So let's look at skilled nursing facility. So it's very similar to a assisted living facility, but the distinction is that there's medical staff 24 hours a day. With the assisted living, the medical staff goes home at the end of the day. Skilled nursing, they always have either a physician or nurses available 24 hours a day. And they can do medical procedures. So here they can do that dialysis, do some rehab for their patients. So right now, it's about almost $16,000 a month for a skilled nursing facility in the Bay Area. So when we think of long-term care, we're trying to project how much are things going to cost 10 years, 20 years, 30 years down the road. So this graph kind of gives you an idea of how much things will cost. And a rule of thumb is every 10 years, the cost will go up 50%. Every 20 years, the cost will double. So when we think of 10 years, so, about $112,000 for home care, assisted living, about $280,000 for nursing home. In 20 years, about $166,000 for both home and assisted living, and then nursing home is, about $400,000 at that point. In 30 years, you could see it's $250,000 for home care, assisted living, almost over $600,000 for a nursing home. So how many years do people need long-term care? So men on average live to about 83, women about 88. I mean, those are just the statistics. So in terms of needing long-term care, men need long-term care about 4 years. Women will need care about 5. And if you have dementia, it's about 6 years. With Alzheimer's and Parkinson's disease, those tend to be longer. So for Alzheimer's patients, it's about 8 years. For Parkinson's patients, which my dad had, it's about 11 years. So what are the options to pay for long-term care, to mitigate the cost? So you either have private care or public care. So the private care would be you ask your spouse and your family can take care of you. You can use your own money. You can use liquidate your assets or just use money earmarked for retirement, or you can use someone else's money. And for the public option in California, basically all you have is Medi-Cal. So let's look at the public option. So one of the big myths in the US is, oh, Medicare will pay for my long-term care. And that's a big myth that is very prevalent. For Medicare to pay for any type of long-term care, you have to be in the hospital for 3 days. After that 3-day stay, they'll pay up to 100 days of a skilled nursing facility. And then that's it. So after 100 days, then if you want to remain there, you have to pay out of your own pocket. So what about Medi-Cal? So Medi-Cal is, as probably many of you are familiar, Denti-Cal, Medi-Cal, it's for the disabled or impoverished. And they do provide some long-term care. So they provide some limited hours at home, and they don't pay for assisted living, but they'll pay for nursing home. But it's based on space availability. So if you live on the peninsula, there might not be any beds on the peninsula. You might have to be in the East Bay or South Bay or further away from your family. And the other thing is, to qualify for Medi-Cal, it's income and asset-based eligibility. So your income cannot exceed this to qualify. So, about $1,500 a month or $2,000 a month. So you have to be pretty low income to be able to qualify for that. So there's 3 options to using other people's money for long-term care. So the first is life insurance with living benefits rider. So I think many people don't realize that some life insurances, they have riders built into it. So which means that if you need long-term care, you can accelerate your death benefit early for a long-term care illness. So the second way to use other people's money is traditional long-term care insurance. And the third is a hybrid long-term care insurance, which is actually life insurance and long-term care joined together. So let's look at this. So life insurance for long-term care. And so it will pay for both like a home care or a facility. But the other thing about life insurance is that some of the policies actually cover for 3 things on top of you passing away. So they'll not only cover for long-term care, they'll cover in case you have a short-term illness, such as cancer, heart attack, or stroke. Third is if you have a terminal illness, to say you have pancreatic cancer, then they expect you to, maybe not last 24 months or less, then you can actually have your benefits early to get alternative treatment or, take care of your bills. You could do anything with the money there. So with the life insurance, you actually have pretty high buying power and leverage. And the reason you have a high amount of that is because with these insurances, it actually is built into the policies, typically at no cost. And it's built into the policies in the term policies, which are the cheaper ones, or the permanent life insurance policies. When you use the benefits are tax-free. And you do have choices. You have the choice of getting long-term care benefits either monthly or as a lump sum, basically like a buyout of your insurance policy. So what are some of the limitations? So the limitations is how much you buy is the maximum of how much benefits you're going to receive. And the other limitation is, so there's a sliding scale of benefits, and it's determined by the illness and the prognosis. So if you think of the lottery, if you win the lottery, if you take the cash now in the first year, you're going to have to take a discount versus getting paid over 20 years. So kind of the same idea. And with this, because it's a life insurance, there is no tax write-off. So let's look at the example. So John has Lou Gehrig's disease. So he has 2 life insurance policies. So he has a $1 million term and he has a $500,000 permanent life insurance. So both policies total $1.5 million in benefits. So what he does, his doctor certifies that he has Lou Gehrig's, he files a claim with an insurance company. And so they basically buy out his policy. So this is gone, but he's able to get $1 million as a lump sum So he could use to pay for his care or do whatever he needs to do to take care of his family with that money. So here I want to talk about the basics of long-term care insurance policies. No matter if you look at a life insurance policy, long-term care policy, or a hybrid policy, this will give you kind of the basics of how to understand how it works. So each policy, you have a policy limit, which is your big bucket of money. Okay. And with that, it will say your policy is a 2-year policy, 3-year policy, 5-year policy. So that's the number of basically that's the number of months this bucket will last. And finally, third component is the monthly maximum benefit. So what that means is so you have this big bucket of 250,000. Okay. So that's your big bucket. So your policy will last 50 months here, and it will pay out 5,000 a month. So how this works is if it pays out 5,000 a month, you multiply it by 50 months, and that equals 250,000. So that's kind of in a nutshell how these policies work. And what is confusing for many people is they'll see the number of months, 2-year policy, 3-year policy, 5-year policy. It doesn't mean that if, in this instance, if after 50 months, at month 51, they're cut off, they have no more money. That doesn't mean it's really a multiplier. So really the biggest thing is looking at the policy limit. How much pool of cash do you have? Whether it takes 50 months, 60 months, 70 months, as you're drawing from it, that money is earmarked for you, and you will not be timed out based on the number of months that your policy says. So there are options with long-term care insurance policies. And the first option is, remember I talked about how inflation will increase the cost. So what this does is there is an option, it's called inflation protection. And what it does is it increases this bucket 2 to 5% a year. So every year on the anniversary, your limit will grow 2 to 5% depending on what you choose. The second option is the elimination period. The elimination period is basically your deductible. It's the number of days you have to pay out of pocket before your insurance kicks in. So typical, it's 30 days, 60 days, 90 days. Those are the typical amount of days that you have to pay out of pocket before your benefits kick in. So let's look at an example here. Oh, but let me show you this for a second. So there are mainly 2 long-term care insurance types. And so one is traditional long-term care. And my wife's a realtor. So with traditional long-term care, it's just like renting a home. So there's no equity. The rates are not fixed. The landlord can raise your rent. And just like a renter's policy, if you're renting a home, you're only going to have a finite amount of coverage. With the hybrid long-term care insurance, remember, hybrid long-term care insurance has life insurance and long-term care attached together. So just like purchasing a home, you can use the benefits, or just like a home, you can live in it. You can actually sell it, or you can pass it to your heirs. And just like a mortgage, the rates are fixed. And just like health insurance right now has no cap. So the hybrid life insurance has no cap. So whether it's 2 million, 3 million, 4 million, 5 million, there is no cap on the amount of coverage. So with traditional long-term care, there are some advantages and some limitations. So the traditional long-term care will pay for your coverage, pay for your care if you need care at home. There's high buying power and leverage. So typically, about 40 times your money, 50 times your premium. That's about ballpark of what you get, depending on age and health. So the benefits when you need long-term care are tax-free. And the policy limits increase with inflation. Remember, I talked about the option there to increase your bucket yearly. So that's there. And depending on your tax status, the premiums are tax deductible. So the deduction is based on your age. So as you get older, you can deduct more of the premiums, but of course, talk to your accountant. If you are Schedule C, you're able to actually, that has the highest deduction when people are Schedule C. So one thing that people don't realize with just long-term care insurance, traditional long-term care insurance, hybrid long-term care insurance, you get a care coordinator. And the care coordinator is basically the go-to resource to see, should I look at this facility? Should I talk to this care provider, this home health care provider? What are the ratings? What is the feedback? So they can really help you, guide you where to go. Instead of looking at Yelp, talking to people on Nextdoor, they will help you, guide you to figure out what is the best route to go for your loved one, for yourself, for a relative. So some of the limitations on traditional long-term care is basically you're limited by what you buy. Many long-term care carriers, the limit right now for some carriers is 500,000 in California. Every state is a little bit different. The premiums may adjust over time. They've had some adjustments in the past couple of years. There's another adjustment coming from one carrier coming up. But with COVID and low interest rates, some of the carriers have had to adjust, but they're not as dramatic as the ones we've heard in 2015, 16. And so if you don't use your care, it's kind of like, renting car insurance, that if you don't use it, you're not going to get your money back, but you have the coverage. So let's look at an example of a traditional long-term care policy. So in 2001, Tammy bought a long-term care policy. So remember, her policy limit was $260,000. So that's her big bucket. Okay. So she is able to get $6,000 a month for 36 months. And so she decided, well, she wants to make sure that she is inflation proofing her policy. So she elects the 3% a year. And remember, we talked about the elimination period, 90-day elimination period. So that's her deductible. So now, 20 years later, she needs care. So right now, she has that 216 has grown to 390,000. So she has a pool of $390,000 for her care. So this gives her 10,837 a month for 36 months. Does she have to use 10,000 a month? She doesn't have to. She can use 8,000 a month or 6,000. So it just extends the length and the time, her pool of money. So you remember that the 36 months is just a multiplier, okay? And the other things about is, even while Tammy is still collecting benefits, her policy limit is still increasing. So that 3% still stays on even while you're using the benefits. And many of the policies have built in to their to the coverage that if you ever need coverage or you ever start using it, your premiums will stop. So let's look at hybrid long-term care insurance. So hybrid long-term care insurance is basically both life and long-term care. So basically, it has all the same benefits as traditional long-term care, but there's a couple of things. So, just like owning your home, you actually have some equity in there. So if the long-term care benefits aren't used, then it becomes life insurance. And with this, there's unlimited lifetime policy limits. So just like your health insurance. And similar to like a mortgage, the premiums are fixed and they can be paid off. And another useful characteristic of the hybrid long-term care is that there's more flexible health criteria. So if you have some health issues, they're more flexible with accepting clients that have health-related issues. One policy will cover two people. So if two partners or husband and wife apply, they apply as one unit. And so what they do is they evaluate the health of the two people, and a healthier person can bring up the health rating of the spouse or partner that is not as healthy. And in some cases, the net cost can be lower than traditional long-term care insurance. But one thing that's pretty unique about this is you can use your money from 401k, IRA, SEP IRA to help fund these policies. So you can use taxable funds to help pay for your long-term care cost and policy. So the limitation is just like purchasing a house is going to be a higher initial cost versus the traditional long-term care. So let's look at an example. So what if you need long-term care? So this couple, they buy a hybrid long-term care policy, and it has a $200,000 life insurance base. So what's going to happen? So Sam has Parkinson's disease. So basically, he's given $6,000 a month to pay for his long-term care needs. And what he does is he needs to deplete the life insurance. So $200,000 after 33 months, that's gone. So what happens? Does he run out of money? Well, because of how these policies are, he has unlimited lifetime long-term care. So he will never run out of money. So this continues despite this being gone. Okay, so that's great for Sam. Well, what about Shannon? Shannon needs care. Shannon still gets the same amount, just like Sam, and she has unlimited lifetime care. So that's really one of the big differences between the traditional and the hybrid. The hybrid allows you to have unlimited lifetime long-term care. Traditional long-term care used to have it, but that ended about 2010. So let's look at this part. So what if they don't use it? So they both pass away in the car accident. So what's going to happen? They put in all these premiums. What happens to the money? Well, what happens is that they get $200,000. That goes to the heirs, to the kids, to the heirs for them. So what happens if they just don't want it and they need their money back? So things are tight for them. They feel they don't need it. They need the cash. So they can actually, depending on how long they've had their policy, they can get their money back based on the sliding scale. So, if they've had a really long time, 60, 70, 80% of their money back. They've had coverage during that time, don't want it, they can get sliding scale some of their money back. So let's talk about some of the common misconceptions about long-term care planning. So these are ones I get day in and day out. So my financial advisor says I have enough assets to self-fund, or I can't qualify for long-term care because I just have health-related issues, or I'm just too old. The other is long-term care insurance is just too expensive and the premiums keep on going up. So let's talk about that. So I like to show this comparison of self-funding versus a traditional long-term care. So This couple is 55. And let's see who has the most buying power. So in this, they're allocating $13,600 a year, which grows 5% annually. And remember, this is pre-tax money. So at year one, they have 13,000 available to that, 13,600 pre-tax. Year 10, 201,000. And let's look at year 20. So typically people will need long-term care 75, 76. So they're almost there. So at year 20, they have about 508,000 pre-tax money for both of them. And so then let's compare it to a traditional long-term care insurance program. So here they're paying about $6,800 a year. So half of what they're allocating for the self-funding. So they have 3% inflation. Okay, so it's going to grow every year, 3%. So right from the get-go, from year one, both between the two, they have 1 million in coverage. At year 10, they have about 1.3, and at year 20, they have a 1.8. So they have about, three to four times as much buying power in year 20, when that's typically when they'll probably need it, than if they just self-funded. So let's talk about the other misconception. So I can't qualify for long-term care insurance because of my health or age. So usually when I have clients that they have, they're on the older side, they have health-related issues, the hybrids are typically the better possibilities because they have looser health requirements. There's less underwriting. Some are able to get underwritten just by a phone call, and they have older age limits. So the best strategy is, if you ever are in question, you talk to your advisor. And what we do is we look at the different carriers, and we get pre-qualified. So we'll send information into the companies. We'll say, oh, this client has this. What do you think? So we'll send that to some of the different carriers, and we see what comes back. Then we talk to the client and work with them and say, okay, well, company A, your chances are not so good, but company C might be good, so let's go with them. So that's kind of the strategy that goes into pre-planning. What carrier will give you the best chance of getting accepted, because 1/4 of all applicants do not get accepted. So let's talk about premiums and potential increases. So they're always a concern. And I tell clients that long-term care insurance it's not like car insurance. It's not like home insurance. It's really more like health insurance. With health insurance, if you get sick, you just don't know how long you can be sick for. And, the expenses could be substantial. So when we look at long-term care premiums, it really depends on what you want. Do you want the insurance company to cover the whole expense, or would you don't mind it being a co-insurance? So you can customize it however you want the premium, or however you want the coverage. And a hint to applying for long-term care is apply with a partner. The partners give you significant discounts. Even if a partner, and this is something that a lot of people don't realize, is even if your partner may not qualify, you apply with them because it gives you the discount. So, the discounts range from 15 to 30%, which is, pretty substantial. And with us, with LTCR, we are affiliated with associations and college alumni. And what we offer is we help people find coverage, but we actually are able, because of associations, we're able to give people a 5% discount on their premiums, not just one time, but a lifetime discount of 5%. So another hint to keep prices low for the insurance is start with the bigger bucket. Remember, we have the big bucket is kind of the controlling factor. So the inflation protection is what really keeps the premium high. So if you start with a bigger bucket and maybe either go to a small insurance inflation protection or a zero, that might help lower the premiums. And finally, if you have a current long-term care policy or a friend has it and you have a large rate increase, modify it, do not ever cancel it. And the reason is that because with all the changes in rates, you will never be able to buy the same coverage you might have bought 10 years ago at the same price. Basically, you're going to get much less for your money. So some things you can do to mitigate that, mitigate the gigantic price increase is freeze or reduce the inflation protection. Remember I said that really increases the price a lot. Or you could reduce your policy limit. So, one thing is if you have a lifetime unlimited, you might start capping that. So that could help offset some of the potential increase in prices there. So from my personal experience, there are so many benefits with pre-planning. One is, like with my dad, it allowed me to just manage the long-term care instead of actually doing it. When you're doing the care, you really miss a lot. You miss the time, you're burning time away that you could be spending with your loved one, talking, just enjoying their time together. And the other thing is that if you don't plan for long-term care, your assets, your retirement, it's earmarked for your enjoyment and for your family. But when you have like a large healthcare expense, basically you're asking your income and your assets to do double duty. And finally, when you pre-plan, it really helps family harmony. So if you have 2 or 3 kids, are they living close? Is one living close? The others are living further? And if you needed help, who's going to be the one to do the doctor's appointments, to do activities of daily living for you? It's probably going to be the child that is going to be closer. And this causes friction between siblings. My sister and my sister live in the Midwest. I lived here. Did it cause friction? Yes, it caused friction because we did 100% of the work, and she didn't have to do anything. So no matter how hard you try to make things equal, and with you guys having kids, that nothing is ever equal when it comes to this. It just won't be equal. So with LTCR, what we have some affiliates and partners, and so this is just a group, and some of the groups we're associated with is AAO, the Academy of General Dentistry, UOP, Stanford, and Cal. And so what we do is we help clients not only find long-term care, but we help with other things as well. And so let me show you that. So we have this program called LTCR Plus. So there's no cost with it. And what we do is we help with the funding, which is what I'm talking about, the different types of long-term care insurance. But we also help families with navigation. So navigation is the care coordinator. Remember, I talked about the care coordinator. They can help you find an agency. They can help you find a assisted living facility. So that's at no cost. We have LTC care audit, which means that just say you have a friend or relative that is in a facility or getting care, and you want maybe a second opinion, you want like unbiased evaluation of the care they're getting. So that's where LTC care audit comes in. So that is fee-based, but they'll have someone come in and evaluate the care that your loved one is getting. And lastly, there's LTC legal. So what they do is they help people with trust, power of attorney, any type of legal issues you might have. So to sign up for that, you just go to here, and what they're going to ask is they're going to ask for a group code. So you can email me and I'll give you a group code. So you could say, oh, Mike, I went to Stanford, or I went to Berkeley. What's my group code? So just email me and I'll send you one. Every school, every association has different codes there, but that's a free benefit to anyone. They're not going to cold call you when you put information in their free resource that's that we provide to the association and the alumni members. So thank you for being here. If you have any questions, you can ask, just please raise your hand and Jim will unmute you and you can ask any questions. Okay, I see a question there, Jim. Can you unmute iPad number 3?
Hello.
Yes. Hi. How are you doing?
Pretty good. Thank you. Thank you for your presentation. Very interesting. Raises a lot of questions for us. One has to do with when does the long-term care policy kick in? I think you mentioned at least 2 out of those 6 things has to be certified by a doctor. And if our son takes care of us in our home, would he qualify to receive benefits?
Oh, okay. So let me make sure I have your question. So one is, when do you receive benefits? And 2 is, if your son takes care of you, can he be paid for the care? Is that your question, doctor?
Yes.
Okay. So typically, for long-term care policies, it really depends on what the elimination period is. Typically, it's 90 days, which means 90 days you have to pay out of pocket yourself. And so some companies, they say 90 days and some say 90 service days. And so 90 calendar days is different than 90 service days. So if it's 90 service days, that could be days where you paid someone, but that could extend past 3 months. It could be 4 months, 5 months, because you might not need someone every single day. Calendar days would mean January 1 through the end of March, the end of March. So typically it depends on your policy, but beyond that, and you have to look in the paperwork and understand your policy, that when it's beyond that, then that's when your benefits kick in. So in terms of your son helping you and being able to get paid, so with some policies, they actually do have a provision in there. Like one is Mutual Omaha, they have a provision in there where if a family member takes care of you, so just say you had something that would pay $6,000 a month, okay? But you decide, well, my son's here, I'm going to let him take care of me. They have a provision in there that allows 40% of that 6,000 to be paid to him to take care of you. So that would be about 2,400. So there, some policies have it that they can pay family members instead of using outside care. Did that answer your question?
Yes, I'm looking through my policy to see what's included.
You can always email. We could always talk. We could always talk.
Yeah.
You could always send me your policy. I'll help you with it.
Okay, sounds good. Thanks, Michael.
Okay, anyone else? Okay, Jim. So do you see any more questions?
Don't see any more questions, but again, oh, is there one more here? Like we have another.
Okay, one more question.
So another question has to do with our current long-term policy that we have.
Mhm.
We've had it for about 13 years. This hybrid kind of thing sounds very interesting. Would it be beneficial to supplement with an additional policy if we already have one? And then I guess the other issue has to do with not really self-funding, but assets already accumulated. When does it become not beneficial to supplement?
I guess a lot of it depends on your age, where you are in your life, your age, and how much you feel. Like I said, if you need long-term care, are you okay with it being a co-insurance, or you want it to pay the whole bill? So those are things that we need to kind of evaluate you and your partner situation, and see where you are. What is it better to stick where you are or add something? It's really customizable for everyone. So I'm sorry I don't know exactly your situation, but we could offline, we can always make an appointment, and then we could talk about where you are, and I'll tell you, you're good to go, stay here, or maybe you could add something. It'll be up to you.
Sounds good. We'll probably call you and set up a consultation.
Okay.
Thanks, Mike.
Okay, no problem. All right. Anyone else? Jim?
Yeah, I'm not seeing any other questions here. We want to thank you for your presentation and your time and just expertise, Mike. If anyone does have any questions, you certainly can reach out to him. You have his email and his phone there. You also see him at our meetings, since we're going to be starting up live meetings again next Thursday and then beginning next year. Well, thank you, Mike, and we wish all of you a good rest of your weekend.
Okay, thanks. Thanks, doctor. Thanks for coming. Appreciate it.